welcome to the Borno Health Update. I am your host, Ibrahim Amarawa. On our program, we track the advancement in the healthcare under Governor Zulum's administration. In this program, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. Proper planning and effective implementation of health programs are among the key factors that have enabled the Ministry of Health to achieve significant improvements in various areas, including maternal and child health, the fight against malaria, and other health interventions. This was underscored during the one-day stakeholder engagement and joint annual review meeting organized by the Ministry of Health and Human Services. The one-day stakeholder engagement and health joint annual review meeting drew participants including various managers, administrators, and field officers from the healthcare sector. The session was aimed at reviewing performance for the first and second quarter of the year 2026 and preparing for the forthcoming annual operation plan. In his opening remark, the Commissioner of Health and Human Services, Professor Baba Malamgana, represented by the Permanent Secretary, Dr. Shatima Maina Muhammad, stated that the Health Joint Annual Review meeting is a crucial part of the ministry's exercise, providing a platform for stakeholders across the health ecosystem to actively participate in the planning process.
On behalf of the Honorable Commissioner of Borno State Ministry of Health and Human Services, Professor Baba Malamgana, who is unavoidably absent because he is engaged in an equally important state assignment elsewhere, I wish to most sincerely welcome all of you to this year's first and second quarter annual operation plans review, and then the 2026 joint annual review. As you are all aware, it has been an annual ritual for all its stakeholders in the healthcare ecosystem together at this kind of times to, most importantly, undertake aspects of the planning cycle. The planning cycle starts from agenda setting, determining clear objectives and goals for the coming year. They are devising various strategies and clear implementation strategies for achieving those objectives, very smart ones. They should be specific, measurable, achievable, realistic, and time-bound. And then, of course, finally, it will be broken down to various programs and activities. And finally, we will also devise a monitoring and evaluation plan to cap it all. No responsible government conducts its affairs without proper planning. That is why the federal government of Nigeria is emphasizing on strict compliance with the development plans, and more particularly in the Federal Ministry of Health, they are always concerned that all activities of the health sector should be done according to plan. All decisions should be informed decisions based on evidence and data. And therefore, that is why Borno State government is no exception. The administration of His Excellency, the Executive Governor of Borno State, Professor Bagao Gana Umara Zulum, is very deliberate and committed to ensuring that all the programs of the state are planned well. That is why we have the 25-year development plan. And again, this is followed up by the 10-year strategic transformation initiative. And I am happy to announce that these plans have been globally acclaimed, and a lot of encomiums have been shown on the state for adhering to these plans. And it is in this regard that today we are gathered here at the instance of the Borno State Honorable Commissioner of Health and Human Services to do our own part of conducting the first and second quarter annual operation plans, and I believe it has already, most of the issues about the annual operation plan have been exhausted over the last 2 weeks. We'll definitely cap it with the 2026 joint annual review, which is mandatory for us to also make our inputs to the health sector strategic development initiative, that is national one. So I wish us fruitful deliberations and reviews, so that at the end of the day, we will review all that we have done in the past year. It is good for us to know where we are coming from, so that we know where we are going, so that we should all take this joint annual review seriously, contribute immensely, so that we will have better review outcomes, so that our next year, 2020, next annual plan will be an implementable and actionable. So on this note, once again, I sincerely welcome us all to this 2026 joint annual review and wish us happy 2020. Thank you very much.
Also speaking, the Executive Secretary of the Borno State Primary Healthcare Development Board, Professor Muhammad Arab Alaji, commended the Ministry for Health for taking planning seriously, stating that any organization that fails to plan is effectively planning to fail. He advised the inclusion of all planning departments within the value chain to ensure unified input, aligning with the principles of one plan, one solution.
I appreciate you all, because AOP is very essential for the success of all the activities in the state. And as it were, we're also aware that through the SWAP program, if you don't really coordinate and get things right, of course, all the benefits we are going to get from the national is not going to really be with us. And therefore, I also look forward, particularly the directorates of planning of all the MDS. I think this is your responsibility. Of course, all the inputs are coming from the focal persons in all the agencies and the boards, but I think the coordinated and articulated that will be presented has to also be done by the planning department. I must also appreciate the Director of Planning, Research and Statistics of the ministry, who has been actually coordinating quite well. He always sends us a reminder to ensure that our planning departments are also brought up. So on that note, once again, I think this interaction will help us to really plan well, because if you fail to plan, that means you plan to fail, and we wouldn't want to do that. So I think this is the first step for us to really do it appropriately, so that through also the SWAP coordinator, or DEX person rather, DEX in the ministry, I think he has to liaise with the planning department, because without the input from the planning department, there is no way we can actually achieve that. Whatever he gets information from the national, he has to put on the tables of all the planning people for them to come with one idea, one input, one submission.
Earlier, the representative from sector-wide approach national office, Dr. Muhammad Kabir, stated that this joint annual review meetings is more than just a performance review. It is a platform that should be utilized to address gaps, build on successes, and ensure the delivery of quality healthcare services that is fundamentally data-driven.
The essence of this gathering is to ensure that we use data, or we're using data the way we should use it. And we all know that data in itself is not the end. Its real value lies in the ability to drive data decision, improve accountability, and direct resources to where they are mostly needed, and also ultimately improve the lives of people. So for this joint annual review, it's much more than just annual reporting exercise, where we just come, look at data. No, it's more than that. It is principal platform for assessing implementation, where we identify bottlenecks, learning from experience, and collectively agreeing on corrective actions. More importantly, it should provide the evidence required to strengthen implementation of the 2026 annual operation plan for the remainder of the year. Now we are in August, we have a few months to go, and also to give us a stronger foundation for the 2027 AOP development, which we have already started the process. So as we review today's and tomorrow's presentation, I encourage us to look beyond the individual program achievements and also focus on overall performance of the health sector. We have had good remarks from the leadership here, so we should look at the overall health sector, also identify interventions that are delivering results, and those that also require some course corrections and implementation gaps that can realistically address the issues before us, before the end of the year, and what we can plan against 2027. I also wish to encourage Borno State to maximize the use of the FASTA platform. The FASTA platform, some trainings will come up very soon, where all states will be trained on the use of FASTA. And alongside that, a data fact were shared, or will be shared. I believe we shared with the states, even if they haven't reached all the program officers. I believe Dr. Muhammad Jamiu will do that before the end of today, so that we can also use that one in addition to all other data sources, the financial and budget execution, also the DHIS tool that we have been using, and also other routine information system. So bringing these data sources together will provide a better, complete picture and of the sector performance that will help us strengthen evidence-based prioritization, reduce duplication, and also improve partner alignment and ensure that the 2027 AOP is more informed by best available evidence rather than just mere assumptions. As implementation of the NISRI and SWAF gathers momentum, integrated planning and coordinated implementation will become even more critical. Every partner, we know that there are a lot of partners in Borno, so every partner intervention, every investment, and every program should contribute toward one state health agenda. We should all align with the state agenda and one annual plan, one shared result framework. I also encourage all participants to engage openly and constructively so that the resolutions emerging from this jar are translated into concrete actions that will adequately lead to costed priorities and measurable improvement in service delivery. Finally, let us remember that for every percentage in our coverage represent real person or real people. They are not just numbers. And every indicator represents a family whose lives depend on the quality, accessibility, and timeliness of the services we provide. Our collective responsibility is therefore to ensure that the data we review today informs the decision we make tomorrow.
In their goodwill messages, the state lead for the Lapia UK program, Dr. Largema Bukara, alongside partner organizations, representatives, lauded the Ministry of Health for convening the meeting. They emphasized that the annual review meeting should serve as a platform not only for identifying and addressing gaps, but also for self-assessment, evaluating our own performance, celebrating our achievements, and strategizing on how to tackle existing challenges.
Previous speakers have spoken a lot about the intent of this gathering and what it should be the outcome of this. However, I may wish to add that this is an opportunity for especially the program officers to not only assess what they have inputted in the 2026 AOP as those activities that they want the state to implement, but it's an avenue for them to assess themselves that yes, those things that we have inputted that will address some of the challenges we have in the health sector, have they been implemented or not? And then you move forward. So in essence, the joint annual review is a two-way front. You review what you want, what you have done, and then see for the future what you wanted to do in the future, bearing in mind that you use data for informed decisions. Previously, AOPs are just a jamboree or gatherings of people. They come and develop papers and everybody move away. But now the approach is changing, especially with the leadership at the Federal Ministry of Health. The SWAP office in particular are the ones championing that we should now have a scientific approach to developing our annual operational plans, and we tie it to the budget and then the resources we have on ground, bearing in mind our peculiarities. That is why you can see that each state is allowed to do its own joint annual review because of our individual peculiarities. So in that respect, LAPIA program has and will continue to support the AOP process. We have done that in the past. We have even done it this week. Or last week, we supported the state to review its first and then the second quarter annual operational plan for the states. And also, one of our objectives as LAFIA is to strengthen the health systems. And you can only strengthen the system when you are able to have an implementable plan, which now that is what we are going to assess. Is our plan implementable? And then what are the challenges so that in 2027 we'll address those challenges. That is why the SWAP coordinator is talking about the CETA and prioritization. They are very, very important when you want to develop AOP in whatever respect. So with this, LAFIA will continue to support you and would support even the federal. In fact, at the state level, what LAFIA will do is we make sure whatever that is happening at the federal level is replicated at the state level. Whatever is happening at the federal level, we make sure is made available at the state level. So there are some instances where we may not know, but if you are aware of it, just bring to our attention. We will assess, we will contact the federal people, and then we'll see how we can step it down to state. Last year, we are also supporting even the federal SWAP office. We have our consultants that are helping them. So also we have consultants that are supporting the state. So we'll continue to work with the state and ensure that we have quality plans that are implementable. You know, the AGR that we are doing now is part of the DLI processes. Last month, Borno was able to win 4 out of the 11 DLIs, and That means the resources will be coming to the state. And the essence of that resources coming to the state is to improve on where we are now. So I call on the ministry to ensure that we judiciously utilize those funds that are coming out of the 4 DLIs, so that by this year or by next year, we will be able to achieve more DLIs, and that means more resources will be coming to the state to improve the health system. So with this, I thank you all for listening.
Leading the session, the state coordinator SWAP, Dr. Muhammad Jamil Sule, presented a comprehensive overview of the progress, gaps, and challenges from first and second quarter of the year 2026, noting that Borno State achieved national distinction in maternal and child health.
For indicators across all indicators in the state, from the malaria performance, RMSCH, non-communicable diseases, immunization, and all other indicators that we report. What have they found? However, this is something that is being reported, but when we come to our own context, specific what we have in the state, it may be different, and that's why we have us here to kind of look at that, critically appraise it, and if we have any suggestions or modeling that needs to be done, then it will also evaluate and discuss that. So finally, after all this, we will come back, inshallah, again tomorrow to have more like a debrief session, make presentations of what the program officers had already put together today, then begin to set what we call the situation analysis of our own context here. That situation analysis will now inform what are some of the key priorities we should be focusing on for 2027. And that's why we have all the field officers here, our program officers, the directors, and even the heads of the agencies. This, once done, will be validated by them. And once it's validated and approved by the senior members of the health sector, then we can begin developing activities. So this is what we actually want to achieve within today and tomorrow, over the next 48 hours. And we really, really implore you guys to be very contributory to the conversations that will be happening.
During an interview, the permanent secretary commended Governor Babagana Umar Zulum for placing healthcare at the forefront of his administration agenda through allocation of adequate resources, a move that has significantly revitalized and strengthened the healthcare sector.
The scorecards are excellent on almost all the indices. Borno State, has performed very well, and we can attribute it first of all to the political will and support by His Excellency the Executive Governor of Borno State, Professor Babagana Umar Zulum. Don't forget, for the last 3 years, we have surpassed the Abuja Declaration of Healthcare Financing. Over 15% of the resources of the appropriation of the state were allocated to the health sector, and then with the technical support we enjoyed from development partners, UK, under the competent leadership of Dr. Lergema, the health sector had never had it so good. We can see transformations in the health sector with the constructions of legacy, health infrastructures like the Kashim Ibrahim University Teaching Hospital. Over 30 new hospitals are built across the length and breadth of the state. Of course, if we come down to the primary healthcare level, all of the primary healthcare centers are being revitalized. New ones are springing up in different communities. Again, we have crashed down maternal mortality by implementation of the MAMI and the Safe Harvard bundle of care. We have also set up the state emergency medical ambulance systems that bridge the delay period where women in labor are transported to healthcare facilities. So a lot is going on, and we are happy, with the progress of, the phase of development in the health sector of the state.
Thank you for joining us. Stay tuned for next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa, reminding you, health is wealth, and Borno is on the rise.